Welcome to The New Health. I'm your host, Jessica Preston, where we speak with thought leaders in healthcare that are revolutionizing the healthcare system. Today back with us is James Maskell. Welcome back, James.
Great to be here with you, Jessica. Thanks for having me.
So happy that you're here. So when we spoke last week, we spoke a bit about your book called The Community Cure. Can we talk a little bit about that community cure and where that thought process came from and how that is changing healthcare?
Yeah, absolutely. Well, it was a combination of a few things. So, I grew up in community. I grew up in a spiritual community, and it's all that I knew until I was 11. And ultimately, when I was thrust back into normal society afterwards, I was always like struck with what was my life like before that, and what was it like after that. And so that was the first piece, is that was sort of like deeply ingrained in me. The second is, as an economist, I was reading a book by Raghuram Rajan called The Third Pillar. And I think, especially as we come into, election season here, right, there's always the theory of like, what is best suited to solve the problems of society? On one hand, you have that government should be solving things, and there's like that thesis. And on the other side, there's that the market should be solving things. And, that's the sort of fundamental argument of who should be paying for or solving problems in society. But what he argued in his book, The Third Pillar, was that there was this third pillar that was dramatically undervalued, which was community. And community is really the theme that where community has fallen away in society, we end up with only government or markets to be able to solve the problems. But historically, community solved many of those problems. And because I'm interested in health and because I'm interested in chronic disease, I could see it so clearly in healthcare, right? In that, think about, do you need a professional grief counselor? Right? We have professional grief counselors now, or professional mental health therapists. A lot of what solved that historically, and why do people in countries with a lot stronger community ties, why do they not have as many of those sort of health professionals, or why does not everyone have a therapist in places there? It's because a lot of that uptake is being taken up by community, right? Even as a father now, like, do I need babysitters or is grandma there? You know what I mean? It's that kind of feeling. And so, that really interested me. And then, on the clinical side, you start to see that, loneliness is such a driver of chronic illness. The Surgeon General has said that being lonely is equivalent of smoking 15 cigarettes a day. And so there's, something that is critical to health, that is very interesting to me from a health economist, and that's why I wrote a book about it.
No, I think that's fascinating. And so community, and we see this in blue zones also, community is that glue that helps with longevity, with blue zones being those areas where people live very well until about the year of about 100 years and then die rapidly, and this is in a very healthful way through their lifespan.
Yeah. No, the blue zones was actually very impactful for me, and as soon as I learned about it, I was like, okay, there is an example of what I'm talking about, right? In those blue zones, the one thing that typically isn't, maybe you could say there is in Loma Linda, California, but in all the other blue zones, there's not an epic functional medicine hospital that's reversing everyone's chronic illness. Yeah. The society and the community creates health by its very nature. And ultimately, those are some clues as to what we are lacking, right, in modern society, what is driving chronic illness, and as an example, what are some of the things that we can build a future sustainable healthcare system on?
And that's a great segue right into how do we get to this community. I mean, we're in this space now where we're post-COVID, we're isolated in our homes, and even prior to that, we were isolated in our homes. So what are some ways when our listeners are at home saying, yeah, the community, what community? We're busy, we're working, we have our people in our own four walls. How are we helping people in this way?
The overall thesis in the book is that community is healthy and healthy behaviors are healthy, and ultimately what we need to do is find ways to bring those two things together. And some of those things may be just in the community and outside of the healthcare system, but I argue one of the reasons why we should be building that in the healthcare system itself is that, one, lonely people end up sick and in the healthcare system, so that's where they end up anyway. And then second, there is budget assigned to do something about this, right? If we think about, Medicare, Medicaid, this is medical budget that's going towards, it's doing stuff could it be doing this? And ultimately, that the thesis in the book is really that we have budget and we have sick people, so let's rebuild community there. But in the book, you'll hear some of the most exciting examples are really just from people in the community starting things. I'll give you an example. So you're from Michigan, right?
Yes, I
so
am, yeah.
in Detroit, there was a doctor there who was a heart doctor, and one of his patients, he was telling him, look, it was a 50-year-old guy, if you want to not have a heart attack in the next 10 years, you need to radically change the way you eat. And this guy realized, this is going to be hard for me, right? I've never cooked this way. I've never eaten like this. How am I going to do that? So they started something called the Plant-Based Nutrition Support Group. And what it was designed to do was for men who wanted to eat healthy to be part of a group, and they would meet every week and they'd have bigger meetings every month. They thought it would just be for a few people, but within 6 months they had 5,000 men that had joined those groups, and they were all in like smaller local groups together. And so now, rather than it's one guy, having to work out, what do I buy in the supermarket? How do I cook with vegetables, right? How do I prepare vegetables in a way that I like? How do I actually cook at home? Rather than doing that alone, this person now had a whole community of men that was supporting him in doing that. And that just happened organically. And that kind of thing could happen organically where you live too. It just takes a little bit of spark to recognize, what are the problems that I'm facing? Are there other people that are facing those problems? And use that as an opportunity. And you see the two things that come together: new healthy behaviors and community structures. Some of the other examples in the book are where there's already community that exists, and by sprinkling a little bit of health into it, you get dramatically different results. So church groups is a perfect example where people are already connecting, already community, already together. And so when you've seen examples like the Daniel Plan, where a group of functional doctors came in and said, hey, you've already got a structure, you've already got social cohesion, you've already got these Bible study Wednesday night groups. Let's get people to talk about doing healthy behaviors together in the service of their temple and the Lord, directly. The results are dramatic. 250,000 pounds lost across 15,000 people in a community. So that is the essence of the community cure.
So when people are at home and they're thinking about, but I don't have this, I think about library groups, I think about women with play groups with children, think about other ways. What are some other ways that people can think outside of their selves?
Well, one of the hard things is the way that community has fallen away, particularly during COVID. I think it's one of the most harmful parts of the policies that came as a result was the destruction of community. I mean, ultimately, I would say to people who are thinking about this, think about all of the different communities that exist, and identify those that are a good fit for you, and go to participate in those communities. Most people who are listening already have some communities that they're part of, and by I've seen very simple things like, instead of having a meeting, let's have a walking meeting, right? I think more clearly when I'm walking, I can communicate better. And so, taking a standing meeting, I even do it in my work where this is like a work call and I'm on a Zoom call, but I'll take it walking because I know that I can hear, I can participate, I can listen, I have my headphones on. It's not really community, but it's healthy things, doing healthy behaviors in structures where I could be, doing unhealthy things, sitting around. So I think, we all have access to different people in our society, in our community, and the question is, will we use those relationships for health, or will we just, do what we're doing right now?
Yes, and I know we were talking community and loneliness, and I just want to clarify for loneliness is that part where we're feeling by ourselves, but we can even be with other people in community and still feel alone. So how are we encouraging people to be able to break through that, into that space of breaking out of loneliness, but opening up in their community?
Yeah, I mean, ultimately, this is levels of friction that I'm still working on dissipating. And some of the things that I'm working on now is, how do you create ways for people to come and be together? I know you're a big proponent of like polyvagal theory, right? And part of that is like, all the time we are sending signals to other people, whether we feel comfortable, whether we feel safe, whether we feel connected. Ultimately, we all have things that we're interested in. We all have like things that we like to do. And ultimately, there's a lot of people just like us who are yearning for that. And it's about, either making new connections or taking the connections you already have and sprinkling some health into them.
Yeah, I think it's important to know that we can say to ourselves, it's okay to feel alone, acknowledge feeling alone, feeling loneliness, and then saying, but what can I do about it? Getting ourselves out of that shell and trying to just make that move, towards community.
Yeah, absolutely. Yeah, it's it's the work of a lifetime. It's not easy, and ultimately, a lot of my time is being spent right now thinking, how do you get that 0 to 1? One of the things that I've seen is that most people don't want to be in a group, right? They think that it doesn't sound cool, it doesn't sound sexy or aspirational to be in a group. When you think about groups, you think about things like Alcoholics Anonymous, right? Ultimately, I think that is changing, but what I've found is that once people experience it once you can be in community and connection with someone and hear about someone's struggles and connect on that level, you are over the hump and you realize that it's valuable. And perhaps in future segments we can talk about some of the things that I found where I've been able to find that for myself and for other men.
I think that sounds wonderful. I think we should do that. So James, thank you so much for being with us again today. Can you please let everyone know how they can find you?
Yeah, my website is jamesmaskell.com. You can find out all my books and projects on there, and on social media, Mr. James Maskell.
Thank you again for joining us. So James will be back with us next week to speak more about the community cure and what we can do for community. And please stay tuned after these messages for our next guest.